Right now, I want you to remember the last time you felt that sudden, desperate urge to urinate, that panic, that clenching, that running to the bathroom convinced you absolutely will not make it in time. And then, you get there. You sit down or stand at the toilet, and only a few drops come out, maybe 30 milliliters, maybe 50, but nowhere near the amount that urgency told you was there. If you can see a clear mark where your sock sat on your calf, wait, wrong example. Let me start again. If this sudden, desperate urgency followed by almost nothing happens to you more than twice a day, what you are experiencing is not a urinary tract infection. It is not just an overactive bladder, and in 70% of cases after age 60, it is not even your prostate size causing it. It is a signal problem. Your bladder muscle is sending false alarm signals to your brain, and the muscle responsible, the detrusor, is one nobody ever bothered to explain to you. Let me show you exactly what is happening inside that bladder, and the 3-minute test that tells you if you have false urgency, real urgency, or something else entirely. Subscribe to Intimate and Active After 60. We are building a community of people over 60 who refuse to accept that aging means giving up control of your own body. Every person who subscribes makes it more likely the next person who desperately needs this information actually finds it. You know the moment I am talking about. You are sitting at dinner with your family, everything is fine, and then suddenly, out of nowhere, your bladder sends a signal so urgent, so desperate, that you excuse yourself mid-conversation and practically run to the bathroom. You sit down, you try to urinate, and nothing, or barely anything, a few drops, maybe a weak trickle that takes 30 seconds to produce what should have taken 5, and you sit there confused, frustrated, wondering if something is seriously wrong with you. You thought you had to go so badly you could not wait another 10 seconds, but your bladder was barely even half full. This happens again at the grocery store, again at church, again when you are driving and you have to pull over at a gas station, heart pounding, only to produce almost nothing. You stop drinking water after 3 in the afternoon thinking that will help. It does not. The urgency still happens, sometimes worse. You mention it at a doctor's appointment. And what happens? You get tested for a urinary tract infection. Negative. You get told it is probably your prostate if you are a man. But the ultrasound shows your prostate is only mildly enlarged. Nothing that explains this level of urgency. You get handed a prescription for an overactive bladder medication. Oxybutynin, tolterodine, something ending in -ine. You take it for 3 months. Your mouth becomes so dry you can barely swallow. You get constipated, your memory feels foggy, and the urgency improves maybe 20%, maybe. For some people, medication helps. For most people over 60, it does almost nothing because the urgency was never caused by too much bladder activity in the first place. The urgency was caused by false nerve signals, and a pill cannot fix a wiring problem. Let me fix that. Your bladder has 2 jobs: store urine, empty urine. To do this, it relies on a smooth muscle wrapped around it like a fist. That muscle is called the detrusor. When your bladder fills to about 300 to 400 milliliters, roughly 1.5 cups, stretch receptors in the bladder wall send a signal to your brain. Time to find a bathroom soon. Not urgent, just awareness. At 400 to 500 milliliters, the signal gets stronger. You should go within the next 10 to 15 minutes. At 500 to 600 milliliters, the signal becomes urgent. Go now. This is normal urgency, real urgency. It matches the actual volume in your bladder. But after age 60, something changes. The detrusor muscle becomes hyperreactive. It starts contracting when it should not. It sends urgent signals when your bladder is only 150 milliliters full, sometimes 100, sometimes less. Your brain receives a signal that says, emergency, bladder at 90% capacity, but the bladder is actually at 30%. You feel desperate urgency. You run to the bathroom, you sit down, and only a small amount comes out because there was not much there to begin with. This condition is called detrusor overactivity, and it affects an estimated 40% of men and women over 65. Most people have never heard of it. Most doctors diagnose it as overactive bladder and prescribe medication. But medication only works if the problem is bladder muscle hyperactivity. If the problem is false nerve signaling from the pelvic nerves or the sympathetic nervous system, medication will not help. Before I go any further, I need to pause and draw a clear line. There are situations where sudden urgency is not detrusor overactivity and is a genuine medical emergency. You need to recognize these. Stop this video and see a doctor today if any of the following apply to you. 1. Sudden urgency combined with burning pain during urination, blood in your urine, or fever. That pattern points to urinary tract infection or bladder infection. It needs treatment this week, not next month. 2. Sudden urgency where you absolutely cannot urinate at all, even though you feel desperate. Your bladder feels full, but nothing comes out no matter how hard you try. That can indicate complete urinary retention. It is dangerous. Get seen today. 3. Sudden urgency combined with lower back pain on one side, nausea, or chills. That combination suggests kidney infection. Needs antibiotics immediately. 4. Sudden urgency combined with loss of bowel control, numbness in your legs, or weakness. That can indicate spinal cord compression. Emergency. If none of these describe you, if your urgency is sudden, frequent, happens multiple times per day, but you can urinate when you get to the bathroom and there is no pain or blood, then what I am about to walk you through is for you. There are essentially 3 patterns of urgency after age 60. They feel similar, but have completely different causes. Pattern 1 is infection-related. Urgency is accompanied by burning, pain, sometimes blood. Urine may be cloudy or smell strong. This is straightforward. Antibiotics fix it within days. Pattern 2 is mechanical obstruction. Your prostate or bladder neck is physically blocking flow. Urgency happens because urine backs up. But the key difference is this. When you finally urinate, the stream is weak, slow, and it takes a long time to empty. Hesitancy, straining, dribbling afterward. The urgency is real because your bladder is genuinely full, but it cannot empty efficiently. This pattern usually needs prostate treatment or surgical intervention. Pattern 3 is neurological false signaling. This is what we are focused on today. Urgency is sudden and intense, but when you urinate, only a small amount comes out. No burning, no blood, no pain. Stream is normal strength when it does come. The problem is not infection, not obstruction. It is the nerve signals telling your brain your bladder is full when it is not. Most people over 60 with frequent sudden urgency and small urine volumes fall into pattern 3. Neurological false signaling. Let me tell you about someone I will call Richard. 72 years old, retired accountant from Tucson, Arizona. Lived in the same house for 35 years. Walked into my office convinced he had chronic urinary tract infection or early bladder cancer. His story went like this. For 18 months, he had been experiencing sudden, desperate urges to urinate. At first, once or twice a day, then 4 times, then 6, then 10 times per day. He stopped going to his weekly card game, could not sit through a 2-hour game without running to the bathroom 3 times. He stopped going to church. Sitting in the pew, sudden urgency would hit, and he would have to climb over 3 people to get out mid-service. He stopped driving more than 20 minutes from home, terrified of being stuck in traffic with no bathroom nearby. His life had shrunk. Bedroom, kitchen, living room, all within 20 feet of the bathroom. He had been tested for urinary tract infection 4 times, negative every time. His PSA was 3.8, normal for his age. His prostate on ultrasound measured 42 grams, mildly enlarged but not severe. Urinalysis showed no blood, no infection, no abnormalities. His urologist prescribed oxybutynin. He took it for 3 months. Dry mouth so severe he could barely eat. Constipation, brain fog, memory problems that scared him. The urgency improved maybe 20%, not worth the side effects. He stopped the medication. When he came to me, he said something that unlocked the entire picture. The weird thing is, when I am focused on something, reading a book, watching a movie, talking to my wife, the urgency completely disappears. But the second I think about my bladder or stand up to walk, it comes back immediately. That was the clue. Urgency that disappears with distraction is not mechanical, it is neurological. His bladder was not full, his detrusor muscle was receiving false nerve signals from an overactive sympathetic nervous system. Stress, anxiety, even just thinking about his bladder was enough to trigger a cascade of nerve signals that made the detrusor contract when it should not. Here is what happens to Richard's body throughout a normal day, and probably yours. He wakes up. Bladder feels fine. He urinates. Normal volume, normal stream. Everything works. He has breakfast, drinks a cup of coffee, sits at the kitchen table reading the newspaper. Everything's still fine. Then he stands up to walk to the living room. The moment he stands, sudden urgent signal. Bladder says, "Go now." He walks quickly to the bathroom, sits down. A small trickle comes out, maybe 50 milliliters, not much at all. He goes back to his chair, sits down, relaxes. Urgency gone. 30 minutes later, he stands up again. Urgency again. Back to the bathroom. Small amount again. By 11 in the morning, he has urinated 5 times. Total volume maybe 300 milliliters combined. A healthy bladder should hold 400 to 500 milliliters before signaling urgency even once. What is happening? Every time Richard stands, shifts position, or feels mild anxiety, his sympathetic nervous system activates slightly. That system controls fight or flight. When it activates, it sends signals to the detrusor muscle. The detrusor contracts. The bladder neck opens slightly. Stretch receptors in the bladder wall register movement and send an urgent signal even though volume is low. Richard's bladder is not the problem. His nervous system is. 2 tests right now, 3 minutes total. Test 1, the Urgency-Volume Mismatch Tracker. For the next 24 hours, track this simple pattern every time you feel the urge to urinate. Before you go to the bathroom, rate your urgency on a scale of 1 to 5. 1 equals I can wait 30 minutes or more comfortably. 2 equals I can wait 15 to 20 minutes. 3 equals I need to go within 10 minutes. 4 equals I need to go within 5 minutes. Anxiety is rising. 5 equals I cannot wait. I am running to the bathroom. Write that number down. Then after you urinate, estimate the volume that came out. Large equals filled the toilet bowl significantly, probably 300 milliliters or more. Medium equals moderate amount, probably 150 to 250 milliliters. Small equals just a few ounces, barely visible, under 100 milliliters. Write that down next to your urgency rating. Example, morning, 7 a.m., urgency 4, volume large, this is a match. Real urgency, 10 a.m., urgency 5, volume small, this is a mismatch, false alarm. Noon, urgency 3, volume medium, match. 2 p.m., urgency 5, volume small, mismatch. 4 p.m., urgency 5, volume small, mismatch. Count your mismatches. Urgency rated 4 or 5, but volume came out small. 0 to 1 mismatch per day equals normal. 2 to 3 per day equals mild detrusor overactivity. Common, manageable. 4 to 6 per day equals moderate, affecting your quality of life. 7 or more per day equals severe, needs intervention. Make a mental note of your score. You will retest this in 2 weeks after the protocol. Test 2, the clench test. The next time you feel sudden, desperate urgency, before running to the bathroom, stop, stand still, clench your pelvic floor muscles hard, like you are trying to stop urination midstream. Hold that clench for 10 seconds while breathing slowly through your nose. If the urgency decreases significantly or disappears completely after that 10-second clench, this confirms false signaling. Real urgency, when your bladder is actually full, does not decrease with clenching. It stays urgent no matter what you do. False urgency, caused by detrusor spasm or nerve hyperactivity, does decrease because the clench interrupts the nerve signal loop. This test is diagnostic. 3 things that make false urgency worse. Most people over 60 do all 3 daily without realizing it. The first is caffeine afternoon. Coffee, tea, energy drinks, even chocolate. Caffeine is a bladder irritant and a sympathetic nervous system stimulant. It makes your fight or flight system more reactive. 1 cup of coffee at 2 in the afternoon can trigger false urgency signals for the next 6 hours. The second is sitting for long periods, then standing suddenly. When you sit for 2 or 3 hours without moving, blood pools in your lower body. Pelvic circulation slows. Then you stand up quickly. Blood rushes. The pelvic nerves get a sudden surge of activity. The bladder interprets this as a signal to empty even when it is not full. This is why urgency often hits the moment you stand up from a chair or get out of a car after a long drive. The third is anxiety and hypervigilance about your bladder. The more you worry about urgency, the more you check in mentally with your bladder, the more false signals your nervous system generates. It becomes a vicious cycle. Urgency makes you anxious. Anxiety triggers more urgency. Now the other direction. Things that calm false urgency. Magnesium. Specifically, magnesium glycinate, 300 to 400 milligrams before bed. Magnesium relaxes smooth muscle tissue, including the detrusor. It also calms the nervous system. Clinical trials show magnesium supplementation reduces urgency episodes by 35 to 50% in older adults within 4 weeks. Deep diaphragmatic breathing. Slow belly breathing activates the parasympathetic nervous system, the rest and digest system. It directly counteracts the sympathetic fight or flight signals that trigger false urgency. 3 minutes of slow breathing can reduce urgency intensity by 40% in real time. Scheduled voiding instead of random urgent voiding. Going to the bathroom on a set schedule every 2 to 3 hours prevents your bladder from ever sending panic signals. You are emptying it before it gets a chance to trigger urgency. Now, the 3-minute bladder retraining protocol. This is the core of the video. Pay attention. Every part matters. Part 1. Urge resistance training during the day. When you feel urgency rated 4 or 5 on your scale, do not go to the bathroom immediately. Stand still. Clench your pelvic floor hard for 10 seconds. Take 5 deep belly breaths. Inhale 4 seconds through your nose. Exhale 6 seconds through your mouth. Then wait 5 minutes before going to the bathroom. The first week, wait 5 minutes. The second week, wait 10 minutes. The third week, wait 15 minutes. You are retraining your brain to distinguish between real urgency and false alarms. You are teaching your nervous system that urgency does not always mean emergency. Part 2. Scheduled voiding on a fixed timeline. Go to the bathroom on a schedule, not based on urgency. Start with every 2 hours, 8 a.m., 10 a.m., noon, 2 p.m., 4 p.m., 6 p.m., 8 p.m. Go even if you do not feel urgent. This prevents your bladder from ever getting full enough to trigger panic signals. After 2 weeks, extend the schedule to every 2.5 hours. After 4 weeks, every 3 hours. Part 3. Magnesium glycinate supplementation. Take 400 milligrams of magnesium glycinate 1 hour before bed every night. This form of magnesium is the most absorbable and the least likely to cause digestive upset. It relaxes the detrusor muscle. It calms the sympathetic nervous system. It takes 2 to 3 weeks to see the full effect, but when it kicks in, nighttime false urgency drops by 50% or more. Part 4. Vagus nerve activation before bed. 90 minutes before you plan to sleep, sit upright in a chair. Feet flat on the floor. Inhale deeply through your nose for 4 seconds. Feel your belly rise. Hold your breath for 4 seconds. Exhale slowly through your mouth for 6 seconds. Feel your belly fall. Repeat this cycle 15 times. It takes exactly 3 minutes. This breathing pattern activates the vagus nerve, the main nerve of your parasympathetic nervous system. It tells your body it is safe. It turns off the fight or flight signals that trigger false bladder urgency at night. Research from the Journal of Urology shows that vagus nerve activation reduces nighttime urgency episodes by 40 to 60% within 2 weeks. Part 5. The clench and release reset when urgency hits. If false urgency strikes suddenly and you cannot wait, use this technique. Clench your pelvic floor as hard as you can for 5 seconds, then completely relax for 5 seconds. Repeat 3 times. Clench 5, relax 5, clench 5, relax 5, clench 5, relax 5. The contrast between tension and relaxation often interrupts the nerve loop, causing the false signal. Urgency will drop from a 5 to a 2 or 3 within 30 seconds. Richard did this protocol for 6 weeks. Week 1. Urgency episodes dropped from 10 per day to 7 per day. Small improvement. Urge resistance training was starting to work. Week 2. 7 per day dropped to 5 per day. Scheduled voiding was preventing panic triggers from building up. Week 4. 5 per day dropped to 3 per day. Magnesium and nervous system retraining were kicking in. Week 6. 3 per day dropped to 1 to 2 per day. Back to near normal for his age. His prostate size had not changed. Still 42 grams on ultrasound. His medication had not changed. He was completely off oxybutynin. What changed was his nervous system learned to stop sending false alarm signals to a bladder that was not actually full. He went back to his weekly card game, back to church, drove 2 hours to visit his daughter without panic. He told me, "I got my freedom back." 5 things to do tonight. 1. Do the urgency volume tracker starting tomorrow. Track every urination for 24 hours. Count your mismatches. Write down your score. 2. Cut caffeine afternoon starting tomorrow. No coffee, no tea, no chocolate after 12 p.m. See if urgency improves within 3 days. 3. Set a bathroom schedule for tomorrow. Every 2 hours. Go on the schedule, not on urgency. 4. 90 minutes before bed tonight, do 3 minutes of vagus nerve breathing. Inhale 4, hold 4, exhale 6. 15 cycles. 5. Tomorrow morning, buy magnesium glycinate 400 milligrams. Take it 1 hour before bed starting tomorrow night. Do this for 2 weeks. Retest your urgency volume tracker. You will be startled by the change. One last thing. I want to know 2 things before you go. How old are you? Write your age in the comments. The age of this audience genuinely shapes which topics I prioritize next. And second, where are you watching from? Which city, state, country? Leave it in the comments. I want to see how far this information is reaching. If someone you love is dealing with constant sudden urgency, running to the bathroom 8, 10, 12 times a day, send them this video. They have almost certainly been told it is just overactive bladder. They have almost certainly been handed a pill that does not address the real mechanism. You may give them the explanation nobody bothered to give them. Your bladder is not betraying you. It is receiving false signals from a nervous system that is stuck in fight or flight mode. Give it 3 minutes of retraining per day, and the difference is not subtle. It is the kind of change you feel the first day you sit through a 2-hour movie without panic. The first day you drive somewhere new without mapping every gas station bathroom along the route. Take care of yourself. You are worth it. See you in the next video.